medical battery versus medical malpractice. So how are these people bringing these cases to court? I'll illustrate two cases, and each has a different claim. In the first case, they sued for medical battery. Medical battery is similar to regular battery. It's the intentional touching by a medical professional in a medical setting. So some of the examples, well, there's an example. A medical provider performs a procedure such as CPR without the patient's consent. In other words, they disregards the advance directive. So you don't have to prove that the touching caused harm, only that the doctor intended to touch the person. In the second claim, they claimed medical malpractice, and you need 4 elements. You have to prove 4 elements to prove med mal. It's the negligence of a healthcare professional which leads to the patient's injury. It doesn't require proof of intent. So it really doesn't have anything to do with battery. It's all about the duty of the professional. He has a duty of care that is owed to his patients. It's a dereliction of that duty which causes the breach of that duty. It's a direct causation, establishing that the breach caused the injury to the patient, in other words, kept him alive for however long, or in the case of CPR, sometimes if it's on an elderly person, they can break ribs. There's a lot of injury that can be caused by going against an advance directive. And then there's the damages. As I said before, it's not just economic, it's the non-economic losses of watching your loved one, of having to remove them from a life support system that you never agreed to have them on in the first place. So these are the 4 elements that have to be proved.